Welcome to another easy nursing review. In this lesson, we will cover type 1 diabetes. But before we begin, let's see if you can get this answer correct. The client's glycosylated hemoglobin, or A1C, is 8.1%, indicating that they have type 1 diabetes. Based on this outcome, what conclusion should the nurse draw? 1. This result is below normal levels. 2. This result is within acceptable levels. 3. This result is above recommended levels. 4. This result is dangerously high. Comment what you think the answer is in the comments below. Now let's begin by first learning, what is type 1 diabetes mellitus? Reduced insulin production and uncontrolled hepatic glucose production are the hallmarks of type 1 diabetes mellitus, which leads to hyperglycemia. Food-derived glucose stays in the bloodstream and contributes to postprandial hyperglycemia because it cannot be used for energy and metabolic functions without insulin. Patients with type 1 diabetes mellitus are at risk for complications such as vision loss, damage to blood vessels and nerves, and kidney damage. However, complications can be minimized by maintaining a normal blood glucose level through consistent monitoring, administering insulin, and dieting. Now, here are the signs and symptoms of the patient. Note that the signs and symptoms will be a fast onset because no insulin is being produced. The patient will present with increased appetite because cells are starved for energy, signaling a need for more food. Increased thirst from the body attempting to rid itself of glucose. Increased urination from the body attempting to rid itself of glucose. Weight loss since glucose is unable to enter cells. Frequent infections as bacteria feed on the excess glucose. Delayed healing because elevated glucose levels in the blood hinder the healing process. Now, let's go over important labs as they will reflect the following. Increased glucose in urine. Fasting plasma blood glucose test with a serum glucose level of 126 on 3 different tests. Oral glucose tolerance test with plasma glucose of 202 hours after ingesting 75 grams oral glucose. Random plasma glucose at or above 200 milligrams per deciliter. Glycosylated hemoglobin, A1C 6% or higher. Okay, let's move on and learn about treatments for type 1 diabetes. This disease requires regular monitoring of blood glucose. The use of insulin is to maintain normal blood glucose levels. Medication and a diabetic diet are needed. Let's go over medications used starting with rapid-acting insulin. Rapid-acting, such as aspart, are administered before meals to help control blood glucose. This medication can be inhaled. Next is short-acting, such as regular insulin. Then intermediate, such as human insulin, NPH, and human insulin, zinc, lenti. And lastly, there is long-acting, such as human insulin, zinc, ultralenti, insulin detemir, and insulin glargine. Great. Now let's move on to nursing actions, which will mainly be patient education because this is a chronic disease. With all chronic diseases, the goal is to help the patient maintain their health. For type 1 diabetes, education will include the following: explaining the disease and the importance of maintaining normal glucose levels, demonstrating blood glucose monitoring, teaching about diet and food choices, including portion sizes, encourage exercise, discuss coping skills to reduce stress, teach self-injection of insulin, explain hypoglycemia signs and symptoms and interventions, such as sweating, lethargy, confusion, hunger, dizziness, and weakness. Teach the management of hypoglycemia. The patient will need to take either glucose tablets or 4 ounces of fruit juice, several hard candies, or a small amount of a carbohydrate. This will raise their glucose level within the normal range. All right, well, you made it to the end of the video. Back to that question at the very beginning of the video. The client's glycosylated hemoglobin, or A1C, is 8.1%, indicating that they have type 1 diabetes. Based on this outcome, what conclusion should the nurse draw? 1. This result is below normal levels. 2. This result is within acceptable levels. 3. This result is above recommended levels. 4. This result is dangerously high. The correct answer is 3. This outcome is comparable to a blood glucose level of 180 to 200 milligrams per deciliter. A 1C is a blood test that shows the average blood glucose levels over 2 to 3 months. People who have high blood glucose levels run the risk of long-term problems. If you got it right, awesome. If not, that's okay, just keep studying. Bonus nursing tips. When you want to know the major difference between type 1 and type 2, just remember that type 1 results in ketosis, and this is due to the result of ketones in blood due to gluconeogenesis from fat. The hallmark sign and symptom that you must remember for exams are the 3 Ps, which are polyuria, polydipsia, and polyphagia. Also, to ace exams, make sure to study the onset times and peak times for insulins. Once you master this, you will get easy points. Always remember that when mixing regular and NPH, that clear, which is regular, is before cloudy, which is the NPH. That's clear before cloudy. Here's how to mix the two medications step by step. 1. Inject air needed into NPH. 2. Remove needle. 3. Inject air needed into regular. 4. Remove regular. 5. Remove NPH. 6. Administer. Well, that ends this lesson. Click here for another nursing video.